Other reasons include a lack of will and resources because of a skewed economy in this region.
Right, now globally, the issue is there's a general lack of awareness from people outside the region when it comes to the high infant mortality rates in sub-Saharan Africa. This can, in a lot of ways, be seen with the anti-vax movement because it goes to show how people, specifically in America, aren't taking notice of how much of an effect the lack of vaccines and modern medicine have on children's lives and the lives of the mothers of those children in sub-Saharan Africa. If these children had access to vaccines for malaria like we have in America, that would go a long way in making it more possible for them to live, like Jono said, past the age of 5. But the lack of awareness and the lack of those medicines in sub-Saharan Africa makes it a lot harder for those children to live and thrive. And with more awareness from people in the outside world, it could really go a long way in improving the lives of children and the ability for these children to even live in sub-Saharan Africa.
On a regional level, due to the history of this region, with shaky borders and ethnic differences, these kids are being born into a place of poverty and starvation and a struggle for basic needs in the region, which makes healthcare inadequate, and it gives them this region is very unstable it has a very unstable environment that leads to more infections or other ethnic ways that like the mothers they stay at home and they won't go into healthcare facilities, or if they have had a kid or they're pregnant, they don't tell the town or tell other people's because of ethnic beliefs or what people will think of them.
On a state level, this is an issue because, as Jono touched on earlier, there is a lot of corruption within the governments in countries in sub-Saharan Africa. If you look at a country like Nigeria, for example, it's a country that brings in a lot of money, but a lot of times that money is spread almost exclusively throughout the government and the highest class in Nigeria. And this is an issue that goes all throughout sub-Saharan Africa. While the government has been making progress in providing more adequate health care and more affordable health care, it's still a long ways away from being what it needs to be in countries in sub-Saharan Africa. And if you look at the chart for what countries in the world have the highest infant mortality rate, sub-Saharan Africa contains 2 of the 3 countries that have the highest infant mortality rate in the world, those being Somalia and Mali, Mali being number 2 in the world, Somalia being number 3. The only country that is above them is Afghanistan. And within these countries, the diseases that are a lot of times taking these children's lives are preventable diseases, such as malaria, like Jono said, a disease that we have vaccines for in the United States and more developed countries.
Stuff like diarrhea and
common colds even sometimes, because they simply just don't have the access to affordable healthcare that can prevent these issues. And even further than the children's lives, the mother's lives, a lot of times giving birth is the most dangerous time in a mother's life in sub-Saharan Africa, because a lot of mothers in sub-Saharan Africa don't have ways to safely give birth to children because they don't have access to affordable health care, and that can be traced back to the government of those countries not taking enough note to these issues. And while they are, like I said, taking steps to provide more healthcare options and more affordable healthcare, it's still a long ways away from being what it is in other parts of the world and what it needs to be in sub-Saharan Africa to make giving birth a safer time in a woman's life, and also, further than that, just being able to keep a child alive for, like Jono said, longer than their 5th birthday.
Potential solutions to this global issue can be seen on a global level and a state level, both having to do with improving healthcare systems that will give the women a safer way to give give birth, and then also after they've given birth, vaccines and other modern day medicines that will help these kids not get infections or not getting these diseases that are big factors in the infant mortality rate in sub-Saharan Africa.
Now what I think is important is for people around the world to take note of this issue and see what they can do to help. After doing our research, I looked into what organizations were available to see what a regular person could do to help this issue. And after looking around, there really aren't many, but one I found was what they call themselves the Save the Children Foundation, and they allow options such as a one-time donation of whatever amount you want it to be, a monthly donation of whatever you want it to be, even a daily donation, in which you sponsor a child and just do whatever you can to help them prosper in life. And there's even more options than that, but it's hard to take an individual stance and donate to a foundation like that when, after looking at it, there really aren't many. And what I think is important is because on the list of UN sustainable goals, the infant mortality rate is not specified within these sustainable goals. One of the ones is the health and well-being of people around the world. And if that were to be an issue that the UN is so focused on improving, then I think it's odd that there aren't a lot of organizations such as the Save the Children Foundation that allow an everyday person to just go onto their computer, go onto their phone, see what they can do to help this issue. And with issues such as hunger around the world being one where pretty much anyone can go online and donate and help. People run food drives all the time to help that issue. But something like this, infant mortality rates, providing accessible, affordable health care, providing vaccines for people in need, providing birth control for people in need where it's not available. That's something that people around the world could really come together to help. And that's something that if people can come together and people can help out with, then the infant mortality rates around the world, specifically in sub-Saharan Africa where they're the most in need of help, could potentially go down. And if, like Jono was saying, the governments of the states within sub-Saharan Africa, if they can improve on the healthcare they're providing right now, if they can improve on that and make it somewhere where it needs to be to help the infant mortality rates, and if people around the world can find ways to improve to see what an everyday person can do to help infant mortality rates, then this issue could potentially not be solved, but it could, of course, the infant mortality rates could go down. And if we're able to do that, then this issue would obviously be greatly helped.
Right now, the issue is not progressing at all in sub-Saharan Africa, so that's a huge thing that needs to start, like even if it's a small start.
And while in a lot of cases mortality rates have gone down over the years, it's not something that has shown room for kind of people around the world to get comfortable. It's something that people should really be opening their eyes towards, something people should really be looking out for. And if we can find more ways to create organizations, to donate to organizations that can help provide affordable health care, birth control, vaccines, medicine, to do everything we can, then infant mortality rate is a problem that I think people in the world could really work to help solve. Around the world, people tend to care the most about the issues that affect them that affect their everyday lives. But the issues that don't necessarily do that are often pushed to the side and paid less attention to. And an issue that we think is the most relevant around the world is the high infant mortality rates in lesser developed countries, specifically in sub-Saharan Africa, where there is extreme poverty throughout the region.
Sub-Saharan Africa accounts for 38% of deaths related to births in the world. From 2007 to 2017, for every 1,000 births in sub-Saharan Africa, there were 28.8 deaths. This is due to a lack of access to healthcare facilities and a lack of access to healthcare, which is not provided by the government, which also is another factor. Corruption of the government in this region is a major issue due to these governments holding onto the money and not putting it into healthcare. which which makes it a problem because it's harder for these families that access healthcare systems or healthcare facilities to get a hold of vaccines and other medicines, modern day medicines that give a better chance for these children to live past the age of 5, such as pneumonia and malaria are big infections that are causing deaths of these kids. In 2011, malaria accounted for a loss of 200,000 or 500,000 lives of children under the age of 5 in the world, and almost all of these were accounted in sub-Saharan Africa.